Hello, everyone. My name is Eloisa, and today I'll be talking about Atomica and how to stop an epidemic with Python. So firstly, a little bit about me. I'm a software engineer and mathematical modeler, most recently at the Burnett Institute, where I've been doing simulations of infectious diseases and other public health issues for the last couple of years. I hope this works. So I simulate infectious diseases, and I also build the backend tools that make this possible. I'm a contributor to Atomica, Cyrus, StarSim, and most recently also CPython. Very exciting. And here's a picture of me with a goat to grab your attention. So, infectious diseases are the third biggest killer worldwide. And this is by a conservative estimate, even when we account for car accidents and cancer. It accounts for more than 13 million deaths every year, and that in 2019, that was 14% of all global deaths. This, of course, has only gotten worse since the onset of COVID-19. So there are a whole series of public health interventions available to us. For example, the main ones would be vaccines, testing, and treatment. However, the best approach is not always clear. It depends heavily on context, such as outbreak severity, funding, and even national context and sociopolitical factors. But there is limited funding, so we can't just do everything and see what works. We need to prioritize. This is what mathematical modeling can be really useful for. We can simulate these outbreaks and interventions and determine the most effective approach without having to actually try it out in the real world with real consequences. There are many applications for policy, including, of course, epidemic prevention, but also a lot of other things. For example, restructuring the healthcare system to reduce wait lists, reducing maternal mortality in developing countries, and even reducing carbon emissions. But most public policy decisions don't actually have modeling to back them up. We don't actually know how things will turn out until we see the consequences in the real world. Sometimes policies can sound great, but they can have unexpected consequences. So, for example, one thing that always comes to mind is this example where the Australian government had these childcare subsidies for stay-at-home mums for them to be able to reincorporate into the workforce. Then there was a modeling study that was done to see what the impact had been and see how this affected these women's mental health. And surprisingly, it actually decreased their mental health. It actually had a negative impact. The reason is because, they had this help for childcare, but then they hadn't been working for several years. The job market changes very rapidly, and they were really having a hard time finding jobs. So that was leading to a lot of dissatisfaction. But when the government implemented both childcare and help to find work at the same time, that is when this intervention had a positive effect. And I would say this is quite counterintuitive because usually you would expect if you put funding into something, you'd expect it to improve instead of the opposite. So this shows that an ill-informed intervention can actually be worse than doing nothing at all. So why is modeling for policy still so rare when we know that it can show us things that we can't see only by talking with experts? Well, it's quite difficult to create fit-for-purpose predictive models from scratch, and it can be very idiosyncratic. So a lot of modeling teams still use very niche, very archaic modeling tools. For example, GUIs that haven't been updated since the year 2000, which lack documentation, tech support, and backwards compatibility. And I think, worst of all, there's no version control. So you have to be constantly saving your work, and it's very difficult to collaborate. It's a total nightmare. So this is, I think, a big part of why it's not used more widely. So then the question becomes, how can we make this easier? Well, here comes Atomica. Atomica is an open source simulation engine that's easy to use and highly configurable. It is a Python package. It's published on PyPI, and it has inbuilt functionality for building models, running simulations, fitting model parameters to data, implementing public health programs, budget optimization, plotting, and many more. It's developed by regular Atomica users, which I think is also one of the strengths of Atomica. So it's developed by people like myself who have a hybrid background in both software engineering and mathematical modeling. So then when we're doing the modeling side, we can see, oh, these are the parts of the process that can be a little bit tedious. Okay, we could improve this in Atomica, so it's better for everyone. A part of the process that we're having to do from scratch again and again, we can just make that part of the package, and it creates this feedback loop of improvement where we get better modeling workflows, but so does everyone else that uses Atomica. Okay, so who here has played Plague Inc? Nice. Well, it's kind of like that, except the complete opposite, thankfully. So let's look at this new hypothetical disease called Python pox. This is completely hypothetical, don't worry. I don't want to scare anyone. It's not the new evolution of hantavirus. But let's imagine that Python pox has been around for a few years, and there are some pockets in the world with very high prevalence. So in most of the world, we've managed to eradicate it, but there are still some places that are really, really struggling to get numbers down. But now there's a new vaccine. So the government of one of these places of high prevalence has asked us to model the impact that the vaccine would have on their population to see if it makes sense for them to have a vaccine rollout. So the first thing we do as the modeling team is we build the model. So in this case, I've got a very, very basic compartmental model. This is called an SIR model. It has the number of people susceptible, infected, and recovered. And these boxes just represent the amount of people in each state. And then we have these flows that go from one compartment to the next, and that just represents how people move through the model. So I'm also going to add births and deaths just to make it a little bit more realistic. And then what change does the vaccine make? Well, in this particular case, let's say we have a vaccine that all it does is it increases the recovery rate. It doubles the recovery rate. So this means that people will recover twice as fast. They will spend half the amount of time infected. So what do you think will happen? Firstly, to the number of new infections and also to the number of deaths. Do you think they'll increase, decrease, stay the same? Yeah. It's not going to increase, right? Because that would be a pretty bad vaccine if it did that. So it's either going to decrease or stay the same. So remember that what this vaccine is doing is it's making people recover quicker, but it doesn't affect infectiousness, infection severity, or deadliness. So I'm going to ask for a show of hands. Who thinks that new infections go down? Who thinks they stay the same? Okay. Who thinks that the number of deaths go down? Who thinks they stay the same? Who thinks that both things go down? Just one person? Okay, so maybe two people. So they actually both go down. So even though we haven't directly affected the infectiousness or the death rate, we are observing a almost 30% decrease in new infections and a 34% decrease in disease deaths. So on the left, we've got the scenario with no vaccine, and on the right, with the vaccine. By the end of the simulation, which I'll show you that simulation in a second, we will have saved 1,075 lives. And that is for a simulation where we start with only 1,500 people. Of course, we could start with different numbers, depends on what we're doing. But this is pretty significant, right? So by the end of the simulation, we have around 5,000 people. So that means that without the vaccine, 1/5 of the people in the simulation, with the vaccine, without the vaccine, 1/5 of the people would have died. So that's huge. And here is the future scenario with no vaccine and with the vaccine. So the data points are on 2025, which is when we implement this vaccine intervention. And as you can see in the original scenario, the infections were just going up. And when we put in the vaccine in the second scenario, it suddenly changes the number of people getting infected each year. So that's a very stark, sudden change. And interestingly, we also have more people susceptible, so people who never get the disease at all. And that's simply because if people recover twice as quickly, they are infected for less time, which means they have less time to infect others, and so on. So I just want to do a quick caveat. This isn't a magical crystal ball. Just because the simulation says we've saved 1,075 people doesn't mean that in the real world it would be exactly that. So these models don't perfectly predict the future, but they do help us to make better decisions. They help us to know what to expect and see what kind of decisions and interventions would be most effective. But how does it work? How do we get from this to this? Well, here is a quick overview of the Atomica modeling process. Firstly, we have a framework and data book file, which we import into Atomica, and we run a simulation to produce preliminary results. Then we have to fit the model to real-world data to make sure that it can accurately predict what will happen in the real world, even though, as I said, it's not a perfect prediction. Then that's how we get the baseline scenario. And finally, we can make some changes, implement public health interventions to get a series of alternate scenarios to see what would happen if we did things differently. So just quickly going through this, the model framework describes the model structure and disease dynamics. So it's the flow chart that I showed you earlier, but in Excel format. So this is what it looks like. This is a very simple version. But first we have the compartments, then the transitions, so these flows that I mentioned, and then all of the parameters. And some parameters can also be described as functions of the other parameters. So for example, the infection rate is a function of susceptible, infected, recovered, and the infectiousness. Then the data book contains all of our data values, which are usually estimates for the model parameters. This is what it looks like. I'm not going to go into detail because it's just filling in the data. And now we're ready to run the simulation. So obviously we import Atomica, and then we load in the framework and data book. So we create a project object. It's all very object-oriented. And this project object simply contains all of the information relating to our model. Then we run the simulation using the run sim method of the project object, and we're done. Now we just need to plot. So we make a plot data object, and we put that and the data into atomica.plot series, and it's really, really simple. So as I said, this is there is so much inbuilt functionality that just with a couple of commands, you can run a whole simulation and plot it. We still have a couple of steps to go though, because as you can see, the data points don't match up with the simulation. So the simulation of the lines, and we only have a couple of data points here because it's a toy example, but we still need to do the model fitting. So this step is called calibration, which is fitting the simulation to the data. We could do this manually, which is what we used to do. We go into the data book, we change the parameter slightly, we run the model again, we see how much it's changed, we go back to we do this whole process. It's very tedious. For some of the really, really complicated models like tuberculosis, this process would sometimes take 3 months. I would not recommend. So one of my contributions to Atomica was relating to this automatic calibration and coming up with a way to make this robust, but also flexible and easy to use. So now we can use automatic calibration. All we need to do is tell Atomica which parts of the simulation match up to which parts of the data. So firstly, we make a new parameter set. This is just a copy of all of our parameters, just to have it all in one place and separate from the original parameters, just to make everything clean. And then these 3 lines are 3 iterations of calibration. First, we calibrate the population. then the disease parameters, and then the disease deaths. So the reason we do it this way, we start from the parts of the model that have the most impact and then go to the ones with the least impact. Because if we calibrated the disease deaths first and then completely changed the population size, we'd have to calibrate the disease deaths all over again. And finally, once that's calibrated, all we have to do is run the simulation again with this new parameter set, and we get our result. So this is the baseline scenario. This is approximately what would happen if we left everything the same and didn't intervene. So as you can see, the infections keep increasing, and we haven't made a really big dent in the infections. And now the alternate scenario. So Atomica has integrated support for interventions, including public health programs and funding allocation optimization. However, today I won't really have time to go into depth because there's a lot of detail. But basically what you need to know is that these public health programs, what they do is they affect outcomes by modifying model parameters under certain conditions. So we're going to take a shortcut by modifying the data book directly. So what we're going to do, we're going to go here to the disease recovery rate, which was initially 0.3. And in 2026, we're going to double the disease recovery rate. And that is how we get our results. So this is just a toy example. I just wanted to be able to run through some of the basic mechanisms of Atomica, but this is used for real-world applications with real-world impact. So my team and I use Atomica for research on, obviously, infectious diseases, including COVID-19, tuberculosis, typhoid, hepatitis C, malaria, etc. Also maternal and neonatal health, and sustainability interventions, for example, in hospitals, and many more. So this research is used to directly inform public health policy decisions and get funding for global health programs, such as the Global Fund. I want to quickly go over a case study that I think is really interesting on tuberculosis in Belarus. So Belarus has one of the highest prevalences of tuberculosis in Europe, and I think the highest number of cases of drug-resistant TB. So it's a big problem for them. And here we have a budget optimization problem where the question is, how much can we improve outcomes if we don't have more funding? So this is a context where funding is really limited. So in this study, they wanted to see how can we improve the future result without necessarily having to put more money that we don't have into the problem. And this is very detailed, so I'm not going to go through all of this. It's just so you can have a visual idea of what Atomica does when it comes to budget optimization. We have the initial budget here on the left, and this is the optimized budget. So we have a few new things that were not being done earlier. Some of the existing things, maybe we have less funding allocation or more funding allocation. I'm not going to kind of go through all of them, but one specific thing that I think is quite interesting is that previously the Belarus government was putting a lot of money into mass screening. But this can work if you have a lot of money and you can screen lots and lots of people. But if you're doing mass screening, but you can't do it for a lot of people, you're just screening random people. So that's not very effective. So instead, in the optimized scenario, there's a lot more resources being put into, okay, if we find someone who does have tuberculosis, we can contact their family members, contact their friends, and then test them. And now that we're not spending all this money doing mass screening, we have the money to actually give those people treatment. And this might seem really obvious, but a lot of public health programs do this and don't realize that that's not very effective. So yeah, a lot of these things, they kind of don't really come out until we've done the modeling and we show the results, and then they go, oh yeah, maybe we should be doing things differently. So here are the results of this study. So just by changing the allocations, not increasing funding at all, these are the number of tuberculosis-related deaths, new active TB infections, and number of people with drug-resistant TB. So the gray line is the baseline, and the red line is the optimized budget. Same budget, just optimized. And what I think is really interesting here is that in all three cases, we've halved deaths, infections, and drug resistance just by optimizing the budget. So I think this really speaks to the power of modeling to solve real-world problems. So I hope the takeaway from today is that we can use Python for a lot of different things. And nowadays, we have all of these amazing modeling tools that we didn't have decades ago. So let's actually use them, because when we use them right, we can actually make a really big impact in the world and save lives. Thank you. So just quickly, in case anyone is curious and wants to learn more, I have some links to the Atomica GitHub repo. It's open source, so you can clone it. There are some tutorials as well that go much more into depth than I was able to today, and a few studies on what Atomica has been used for in the past. So all these links can be found here on Linktree and on the QR code. And if you'd like to add me on LinkedIn, I'm Eloisa Pérez Bennetts. I'm also open to backend software engineering and data engineering roles, so I'd love to hear about those afterwards. Thank you very much.
Any questions? Yes.
Mm-hmm.
I guess it depends what model you do. You get like these different, like how configurable is the graph? Do you get like frameworks for figuring out?
It's fully configurable. Yeah, so I mean, I didn't go into too much detail just because I didn't want to get bogged down, but you mean the framework, right? So yeah. Yeah. So on the left, on the left we have the where the flows are coming from, and at the top where they're going to. So we can connect any two compartments with each other. So it's fully configurable. Can you do some what, sorry? Yeah. So that also, this was a simplified example, but we do have time series support. So you could have a time series going back to the 1960s if you wanted to now, depending on what type of disease, how long it's been going for, et cetera, et cetera. Yeah, and then you know, in this case, we only have two data points, 2016 and I changed this. Yeah, we just have two data points in this case. But we could have a data point per year, per month, whatever we like. So that way we can show, yeah, like big increases, for example, with COVID, that's very important, yeah. Yeah, there is a way to make error bars, which again, so that is here in this case, that's sort of the error. But what was the first part of the question? Yeah, we do have different ways to look at that. How do we know how accurate it is? Well, so we can do this thing where we pretend that we're in 2015 and we predict the 10 years of the future up to 2025, and we see how accurate that is, right? And if that fits what we observe from 2015 to 2025, then we know that our parameters are probably pretty close to the actual values. No worries, thanks. Yeah.
Does Atomica provide some way to produce relevant outliers?
To produce outliers. That's a bit more complicated. Like in the data, if we have strong outliers, the model will try to just match everything. But in some cases, we do actually want those to be incorporated. So usually automatic calibration, it just kind of considers everything as a whole, and it just provides a multiplying factor. So if this parameter is not quite fitting the data, then we multiply it by 0.5 or by 2 or whatever. In some cases, specifically when we know the data of origin is potentially flawed, which does happen a lot in public health, we can have a multiplying factor to a previous, like a specific part of the model. For example, if a healthcare definition changes in 2015, we're going to have different data in 2015, like before and after. So we can do that, but then that has to be a little bit more manual, like ourselves in the database. Any other questions? Yeah.
Yeah, mostly about technical parts. Like, I see, like it seems that it somehow like processes the data from the with the model. Are there like any means of calculation optimizations being included or being able to plugged in, like for parallel calculations if you're processing like a big amount of data?
Yeah, so we do a lot of this in parallel. Like this is a very simple example, but a lot of the time it's, models with hundreds of parameters.
Mm-hmm.
So if we just do it on our laptop, it's going to take hours and hours and hours and hours. So yeah, the optimization part specifically, which is the most intensive, that we usually do with HPC infrastructure. And that is, set up to be parallelized very easily.
But like any sort of pluginability, like for example, trying to replace some of the parts of the system or trying to run it, like say, on a different like HPC environments, like for some, it's like with a Swarm or with the Kubernetes, whatever's available. Like, is there like means of configurability in this library?
Yeah, I mean, I would definitely say it's configurable. Like we personally in my team haven't used it with Kubernetes and so on. Mostly we just use HPC because it's a research center and that's what we have access to. Also, like we've also used like different kinds of cloud parallelization. Yeah, like I mean, it's built in a very modular way, so it's very easy to use the parts of the code that work for you. And if there's something that there isn't inbuilt support for, you can just implement that yourself. No worries.
Do you need any extra plugins to make it work on an HPC cluster?
No, not really. Just the Python script. It just, just works.
Interesting.
In your experience, to make it scale,
Sorry, it's a bit hard to hear you from back there.
in order to scale,
Yeah. We've only done it with CPUs. Yeah, I'm not. You probably could try to do it with GPUs, but that's not my domain of expertise.
Okay, I'll say let's finish here. Thanks very much, Eloisa, once again.
Thank you guys. Cheers.